As quality improvement, or QI for short, has become more rigorous and systematic over the past couple of decades, it's become increasingly difficult to draw a line between it and what we've traditionally considered research. The definition of research, according to the Belmont Report, is, quote, an activity designed to test an hypothesis, permit conclusions to be drawn, and thereby to develop or contribute to generalizable knowledge. Some features of research include its systematic nature, the use of a protocol to pre-specify objectives and methods, and the intent to generalize beyond the individual studied to the larger population from which they were drawn. In contrast, there is no single consensus definition of quality improvement. According to Joanne Lin and colleagues, QI involves, quote, systematic, data-guided activities designed to bring about immediate improvements in healthcare delivery in particular settings, end quote. I'm sure you can see that this has much in common with research, as defined by the Belmont Report, including the systematic nature of the activity and the intent to use what's learned to benefit others. Even if a QI activity doesn't meet the definition of human subjects research, and therefore doesn't need to undergo IRB review, you still need to make sure that what you're doing is ethical. That includes making sure that you've taken steps to minimize the risks to patients of what you're doing. It also includes thinking carefully about whether informed consent is needed. And even if informed consent is not needed, it's often wise to be transparent about the QI projects you're doing so that no one can claim you're doing things in secret. Finally, it's important to have some form of departmental, institutional, or peer oversight of QI activities that don't undergo IRB review. All of us are prone to biases and blind spots in pursuing our own agendas, so it's best that other people who are reasonably impartial have the opportunity to look at what we're doing. That way, they can catch any problems or potential criticisms that we may have missed in our own work. In this lecture, I've emphasized a few key points that I hope you'll take away. First, the distinction between quality improvement and research is very fuzzy. Second, QI is defined primarily by the fact that the primary intent of the people conducting it is to improve local practice and outcomes. Third, some QI activities meet the regulatory definitions of human subjects research and therefore may need to undergo IRB review and approval. And finally, even if a QI activity doesn't require IRB review, you still need to pay attention to its ethics and should consider some form of departmental or institutional oversight. And as you assume roles as institutional leaders and innovators yourselves, you should think about what forms of oversight to put in place for the groups that you lead.